Welcome back to Startup Health Now, the podcast where we celebrate the entrepreneurs and innovators who are transforming health. I'm Logan Plaster. This week, we're talking about youth well-being in the digital age with Katya Hancock, founding executive director of Young Futures. Last year, Katya helped launch this nonprofit with funding from Pivotal Ventures, Melinda French Gates, and Susan Crown Exchange. Before that, she was part of the core team that built Startup Health and remains an active member of our Impact Board. I wanted to take a few minutes and learn more about how she's bringing her experience with startups into the nonprofit world. Young Futures is all about helping young people thrive in a digital world, but it's not all about limiting screen time. In fact, a core message for Katya is that we need to shift the narrative away from moral panic, like throwing away all kids' devices, and focus on real-world solutions. It's all about innovating within the digital tension that young people feel today.
Most teenagers know that they are on their phones too much and they want to have a healthy relationship with tech. And they know they need to log off, say at 11 p.m. because they have a midterm in the morning, but they might have a friend who's having a mental health crisis and they feel like they have to be available to that friend.
In our conversation, we'll hear about Young Futures' first funding challenge, where they committed $1 million to nonprofits focused on loneliness, social connection, and well-being.
The reason we started there is we're building on Dr. Vivek Murthy, the U.S. Surgeon General's advisory around the loneliness crisis in our country, as well as youth mental health crisis.
We'll also hear about a few of the companies that received that funding this year, including some youth-led efforts. Let's dive in. Katya Hancock, thank you for joining me today. I'm excited to talk to you and share with our audience a bit more about members of our Impact Board. So thanks for joining me.
So happy to be here.
So I want to start by just getting to know you a little bit more. You are let me get your title correct, founding executive director of the nonprofit Young Futures. And so I want to hear all about the work that you're doing there and what it was like as a founding executive director, since I know you were really there at the beginning, at the formation of everything from the logo to really how this was going to roll out online. So let's just start by telling me a little bit about the work you're doing there, what you're focused on.
Absolutely. So Young Futures is a new organization focused on making it easier for young people to grow up in the digital world. And I come to this space, as you know, for the last 10 years, I spent help building Startup Health as a founding team member there. And my background is really from the tech startup side of the world in the for-profit world. So I have built multiple tech startups from early stages, a couple of which were acquired, and then helped build Startup Health for a decade, and really caught the bug of supporting innovators and the power of ecosystems to solve big challenges, which you know very well what that's all about. But I found this opportunity to address this particular challenge around youth well-being and youth mental health, one that I just couldn't resist diving into. And so Young Futures is a really unique organization. It was founded, we just started building it last November, and several funders came together who had been co-funding work in this space for a number of years. And the two initial funders are Pivotal Ventures, Melinda French Gates' company, and Susan Crown Exchange, another amazing female philanthropist. Susan Crown leads that organization. And they had been funding work around youth mental health, youth well-being, and the impacts of technology and how that has transformed the experience of growing up as digital natives, and saw that there needed to be a lot more than just some programmatic funding and funding of research, but an ecosystem play. So how can we lift up a lot of solutions, specifically nonprofit solutions, community organizations, grassroots orgs that are in schools, in communities, et cetera, across America, already working with teens. And we actually work with preteens and teens, so ages 10 to 19. And so that was the idea that I came and met with those funders when they were forming that idea. And we really saw eye to eye, and they asked me to build this organization and lead this team.
Okay. I want to hear more about the work that has come out of that. But first, talk to me about the challenge a little bit more. You know, there's a lot of hand wringing around young people growing up in the digital age and There's a desire to just sort of throw away their smartphones entirely. And talk to me about some of the tentpole health challenges that are real and tangible that we need to be thinking about around young people in today's digital environment.
Yes. So there's a number of ways to approach this space. We talk mainly about youth well-being, which encompasses youth mental health. So we are definitely worried about teens that are already diagnosed with anxiety and depression, for example. And we're also trying to support more broadly all young people. So that also includes a teen who's just kind of doing okay and they're not thriving. So, well-being is the larger umbrella. We're also really concerned with marginalized communities, kids of color, LGBTQ kids who are experiencing the worst mental health outcomes in America. So we're taking this approach of how can we shift the narrative in this country from frankly moral panic and just obsessing over the challenges to what are we going to do about it? How can we help? How can we serve up solutions? Because, as a parent, every family is really left to their own devices, literally and figuratively, to figure out how to navigate this. And so there's a real lack of solutions. The solutions actually exist, but they need support. There's also a
Mhm.
funding gap at the earlier stage nonprofit level. And then those nonprofit leaders could use some support as they're trying to scale their impact and get to the next level. And that's where we come in.
Give us a sense of some of the innovative companies and startups that you've started to work with that are trying to address some of these challenges.
Yes. So they're all nonprofits. They're not startups. Uh,
Okay.
we host 2 funding challenges a year. We commit $1 million each time, and we have done 1 funding challenge to date. Our first funding challenge was called the Lonely Hearts Club Challenge, and it was focused on loneliness, social connection, and well-being. The reason we started there is we're building on Dr. Vivek Murthy, the U.S. Surgeon General's advisory around the loneliness crisis in our country, as well as youth mental health crisis. And we know there's a huge body of research to show that when young people have protective relationships, such as close relationships with their family, their friends, their community, they are much better equipped to handle hurdles that come their way and challenges that come their way.
Yeah.
And when they don't have those kinds of real meaningful social connections and they hit speed bumps, they're more likely to have anxiety or be depressed.
Sure.
So these are really sort of protective factors, these social connection relationships. So we started there because we want to go upstream and help build a foundation where young people can start from a strong footing as they're growing up in the digital world. So we put out our RFP when we launched at South by Southwest this year. We had about 200 nonprofits apply, and we just selected and announced our first 10 grantees at the beginning of this month.
Nice. Nice.
So they are incredible. They're all over the country. We have a few that are working in sort of the creative realm. So, for example, there's an organization called Hip Hop into Learning out of Louisville, Kentucky, and they are really focused on helping kids express themselves through hip hop and connect in to their emotions and find community and belonging through that kind of programming. So
Hmm.
they're really helping kids, have a place to be and feel that their voice really matters and find belonging through expressing themselves. And a lot of what they talk about also is what does it mean to be living in this digital world, and how can you harness things like social media and technology in a way that makes you empowered and have agency.
Interesting. Are you finding that as you get into actually selecting the companies and working with them, that the aperture around what you were defining as young people thriving in a digital age, that's sort of widening? I mean, you just mentioned hip hop. It's not like directly connected to, say, social media, or maybe what I would like immediately think of as like
Mhm.
youth plus digital, plus health. So
Yeah.
is the view widening?
The view is really wide. There's a lot of ways in and a lot of ways to support
Hmm.
young people and their well-being. And again, if we go upstream and provide some support at the social emotional level, then as they're using social media and technology, they're
Hmm.
better equipped. to have a healthier relationship. So that's one way in social connection. We're going to have 2 funding challenges a year. So we have a long list, a long pipeline of potential funding challenges. So we're also talking about supporting programs around safe digital play and gaming, tools for educators, supporting youth community builders, and movement builders. There's all kinds of ways in on this. And so the idea is we want to support hundreds of these, we call them Young Futures Innovators, the grantees, hundreds of these Young Futures Innovators, and then bring them together in an ecosystem. And so they can collaborate, which we got to be with our first 10 grantees in person last week in DC for a retreat.
Nice.
And the amount of excitement between them around, wow, I'm not alone anymore. We're part of a movement together. And also, let's work together, let's collaborate. It was really special.
So are you finding that the breadth of, you said there's lots of ways into the family, to the community, the breadth is more of a strength than a challenge in terms of saying, like, how are we actually knitted together as a community?
Yeah, the breadth is, there's, like I said, there's a number of ways in. There are lots of different approaches. Some are of our 10 grantees, 3 have a regional focus, 7 have a national focus, for example.
Got it.
They're serving different communities, different demographics. They themselves, the YF innovators, are very diverse in terms of gender, race, age. We've got a number of youth-led organizations as grantees,
Nice.
all the way up to, we have a grantee called Sesame 3G, which is led by a gentleman named Louis Bernstein. He's on the older end of the spectrum. He worked for Sesame Street for 40 years.
Wow.
And so he has a nonprofit that brings together seniors with teens and preschoolers in 3-person mentoring, which uses social emotional lessons from Sesame Street. And the teens have amazing outcomes because they all of a sudden feel really needed. They're mentoring these preschoolers, they're learning from the seniors. It's just this amazing kind of cycle of positive reinforcement. So yes,
Love it.
the approaches and the demographics are really wide.
And yet, helping youth thrive in today's digital age, that's the connecting tissue.
It is, yes. Each one of them, for this first funding challenge, they had to be able to answer that question. How are you helping young people grow up in the digital world? How are you addressing the digital tension that young people feel? And we talk about that a lot, the concept of digital tension, because, and that concept is why the answer to this is not limit screen time. And so when I say digital tension, it's things like, most teenagers know that they're on their phones too much and they want to have a healthy relationship with tech. And they know they need to log off, say at 11 p.m. because they have a midterm in the morning, but they might have a friend who's having a mental health crisis and they feel like they have to be available to that friend. Or they want to use their phone less, but they need to even email their teachers from their phone. They need to do schoolwork on their computer. They need a phone to order anything at a restaurant oftentimes. So they're growing up in such a different experience than we did.
Yeah.
And so a big thing that we really talk about is for parents especially is just having an empathetic approach when you're talking to your teens about what's going on, instead of just assuming, oh, all your problems are caused by the phone. Like there are a lot of things playing out on the phone. They mirror the offline experiences. They're
Yeah.
just amplified with technology.
Yeah, I feel like parents ought to be pretty empathetic because most of us struggle with overuse of technology as well. So it should be easy for us to understand the challenge.
Yes.
Having talked to the first 10 grantees, you mentioned before that you come from this startup world, moving into the nonprofit space. What are some of the concrete ways that you've been able to bring some of that knowledge over? Where are you seeing some sort of maybe some nonprofit gaps where some startup wisdom can be helpful?
Yeah, so we're really excited because with our grantees, we're going to support them in a 6-month program called Young Futures Academy. And we're really there to support them as leaders. And of course, that will translate to their work. they're all very successful in their own right already, and we want to help them get to the next level. And so we're going to bring in a series of experts from both the nonprofit and the for-profit spaces to help them with leadership skills around scaling and growing an organization, fundraising, storytelling, and communications, and then lastly, subject matter experts around things like social connection, youth engagement, et cetera. But some of the things that we're going to provide are simple things like office hours with an HR expert or office hours with an accountant who can help you talk through your budgeting for the following year. And those things are expensive and they're time consuming to track down for a nonprofit leader. But some of the things that I think really translate from the for-profit startup world to the nonprofit world are around goal setting,
Mm.
and communications with funders and potential funders around, okay, this is where I want to go, and this is how I'm going to get there, and these are my priorities over the next quarter, year, 3 years, and even this is my 10-year goal. And it can be difficult from a cultural perspective for nonprofits to always think about those longer term goals, because funding is so scarce, and they're often just really in this cycle of worrying about funding and applying for grants, et cetera. And at the same time, it's sort of a double-edged sword because funders want to hear about big visions in the nonprofit space as well as the for-profit space.
Yeah.
So those would be an example really
Yeah.
of a learning. And then the other is in the for-profit startup world, there are a lot of organizations, like Startup Health as an example, that support CEOs and founders. There are meetups and peer communities and accelerators, and there's a whole venture capital industry. And so there's just less of that kind of support for nonprofit leaders. That infrastructure for the ecosystem is not as robust. And so even bringing them together as peer groups and forming kind of these peer advisory boards has already been really powerful.
Very nice, very nice. Shifting gears slightly, we're talking today because of your presence on Startup Health's Impact Board. What do you hope to bring to that group? What are you excited about in terms of the work that the Startup Health leadership is currently engaged in?
Yeah, I mean, I think it's really always, especially now, my job to make sure that young people are part of the conversation. When it comes to healthcare, young, children's health, youth mental health does not get the majority of the funding by any
No.
stretch or attention because young people don't cost the system as much money. Like that's the bottom line. That being said, we are in a youth mental health crisis. I think organizations like Startup Health, the model, the media company, which you're leading so well, can do a lot to raise awareness for things like that, and also I'm building a different network than the one that I had at Startup Health. And so anything I can do to support the work that you all are doing, I'm always a number one fan.
What do you wish more people understood and appreciated about today's youth mental health crisis?
hmm It's really that piece around digital tension and how complicated it is,
Yeah.
and how youth are not a monolith. They are not one size fits all. And so to come in and just say, screen time is the issue, it just doesn't cut it. It won't encourage any conversation intergenerationally. That's not to say there isn't a really important discussion to be had around delaying access, right?
Right.
There's TikTok, 9-year-olds shouldn't be on TikTok. There should be many conversations and boundaries around usage and access, et cetera. But as we just talked about, young people are growing up in a digital world. It exists. It's they don't even really reconcile online versus offline behavior. So for adults to come in asking questions, and really being more of a coach versus a referee, as a colleague of or friend of mine at Center for Digital Thriving, Emily Weinstein, says, that's really always a good message to leave people with.
Yeah. I have to ask, because you have young children and I do too, how if at all, have you changed your view of devices and technology since you helped found Young Futures?
Yeah, that's a great question. So my kids are 7 and 9. They don't have cell phones yet. They do have iPads. I will say screen time has gotten less over the the last 7 months that I've been working on Young Futures. That being said, that was kind of already on our radar. For example, we just find it's better to have screen time only happen on the weekends because during the week now my older son has homework. There's just not really time. Um, the thing I think that is the most significant is myself and my husband Unity are so much more aware of the behavior we're modeling. And you
Mm.
mentioned that earlier. I really go out of my way to not have my phone around at meal times. I try to just leave it upstairs in my bedroom as much as possible when I'm around my kids. I'm not really on social media much anymore, although that's a little challenging because I have to be for Young Futures. But
Yep.
you know, I'm definitely very aware of the behavior I'm modeling, and nobody's perfect, but doing my
Yeah.
best.
What I'm hearing from you is on one hand, there's this tension, and you're trying to not preach digital abstinence and say, look, it's a very, very nuanced conversation. On the other hand, you personally are moving towards trying to regulate and trying to
Oh
limit.
yeah.
Uh,
Yes. I'm not trying to have abstinence, but I'm definitely trying to have a healthier relationship
yeah,
myself
yeah.
and model that. And of course my whole life functions on technology. I use my phone for everything like all of us. And I now have just more of an awareness of how my kids are perceiving my behavior and how intentional I want to be about being present when I'm with them.
Here's a sort of a wild card question to close with. We talk a lot about collaboration at Startup Health, and I'll bet you do too at Young Futures.
Mhm.
And I'm always thinking about if I could wave a magic wand and bring two companies together or three companies together, what would some of those magical collaborations look like? And it's interesting to think about Startup Health and the kind of companies we work with. Very few of them have a youth health angle. Many of them could benefit from the work that you're doing and kind of blending these different visions. And I wonder if you could bring a couple or three different types of businesses together. Do you have an idea of kind of what that might look like, or just what would be cool to see?
My dream is for Young Futures to be more of an entertaining media company um, in order to disseminate the solutions that we're supporting. So in this world where we're just saturated with content, as you know, you can't talk at people, you have to draw them in and be
Yeah.
engaging. So when I think about how I want our voice to develop, I want us to feel that we're not a nonprofit, that we're more of a just a consumer facing organization that is here to help people and that does it in a way that's entertaining. So I'd love to partner with any consumer facing companies who share our core values and our brands. I love the messaging of some of the sports companies like Nike and Adidas and the way that they highlight athletes in a way that celebrates who they are as humans.
Hmm.
I think of our Young Futures innovators in those ways too, and want to make them superstars because they are. So I'm pretty open, but I'd love to strike up some pretty unconventional partnerships in terms of the nonprofit space.
First name that comes to mind is someone like Mr. Beast, someone who's already in front of the
Yep,
kids' eyeballs, and start
absolutely.
start start getting someone of that caliber, or someone of great influence to start talking about these issues.
Mr. Beast is part of your lexicon.
Yep, yep. You heard it here, Mr. Beast. Um, Yeah, but basically, figure out where the eyeballs already are. Figure out what those media companies. Well, I say that because now I'm old. My first response was, "Oh, so like Young Futures meets MTV." That was where my head went, and then I realized
Right.
that's not it.
Yeah, although
Um,
we do know some great people over at MTV. They have a group that does impact work, and
Okay.
they're doing a lot to support youth mental health, actually. And
Okay.
that
Okay.
organization.
So it's still around.
They're still around, just not in the way that we knew growing up with
Okay. Okay. Very,
TRL, all the good stuff.
very nice. Okay. Katya, thanks for taking time with me. I'm so happy that you are on the impact board currently. You're bringing not only just a decade plus of time with startup health to your experience, but now this really fascinating and important work at Young Futures. It's exciting to read about, which I already have, the inaugural class, and to know that you're going to keep doing that and keep building this community forward. So look forward to reading more about the progress and getting another update in the future.
Thanks, Logan.
All right. Take care. Be well.
Thanks for listening to Startup Health Now. We'll be back again with another episode next week.